You're looking at a drug, Tosedostat. You're looking at it in the setting of elderly acute myeloid leukemia. Can you tell me what it was you were trying to investigate here?
Well, elderly acute myeloid leukemia is an unmet medical need for therapy, as patients frequently are resistant to intensive chemotherapy or get side effects, and their survival is very short.
And could you tell me something about Tosedostat, what it is and how it works?
Tosedostat is an aminopeptidase inhibitor. Aminopeptidases are enzymes that work all over the cycle of the cell and are linked to many important functions. And here we coupled Tosedostat with the low-dose RCs, that is a recognized drug for acute leukemias.
So what did you do in the study?
Well, we studied 33 patients according to a Fleming's method for numbers, and we administered Tosedostat for 240 days continuously, and up to 8 cycles of low-dose RC. And we observed a complete remission rate of more than 45%, so really significantly higher of in comparison to the 25% that was the favorable result of the study in our statistical method.
Right, now that was in patients de novo, treated for the first time. Some of them might have had myelodysplastic syndrome.
They were de novo or secondary after myelodysplastic syndrome. So, more than 30% had adverse karyotype, so it was a very poor prognosis series, that is. So,
how much did the complete remission rate improve?
It improved more than 20% in comparison to the normal 20-25% that you need to reach with this, but more. We have still 6 patients in CR after more than 500 days. And that is very important for this series of very poor prognosis patients.
Do you feel there could be a signal on overall survival?
Well, up to now, overall survival is 7 months, and so this is quite good, but in line with good overall survivors for this kind of studies. But more, we studied these patients with a gene expression analysis system, and this is another point that will give interesting results.
Right, so what is it in the gene expression? Which factors are you looking for that predict CR?
We studied leukemic cells. Up to now, 15 patients are available, and others are in study. Out of these 15 patients that were CR versus no response, we analyzed with a transcriptome 2.0 array that covers more than 285,000 genes, and we found a gene set of 212 genes differentially expressed in CR patients who obtained a response in comparison to the others. And this is important because if we are able to validate in the future this, we will find probably a small gene set useful as a companion tool for therapy.
Right, so you could have prediction by a manageable number of gene variants.
Yes, the hope is this one, just to get a small set gene instead of 212.
So you've got proof of principle at the moment with the 212,
that's true.
But you're hoping to get that down.
We are just validating it now, but they have not the final result of the validation, and we should later make a reduction gene set.
Clearly, it's interesting that your drug works and that it's improved complete remissions. It's also interesting that you've got some genetic information. What should doctors be thinking about this right at the moment? It's early days, of course, but interesting data.
Well, it is a quite manageable drug, and this is important because we use the low-dose RC to debulk the disease, and later Tosedostat, even sometimes at lower doses than the starting dose, was well tolerated for longer period of times. So it could become even a maintenance drug after intensive therapies, not only for the elderly, but in my opinion, even for frail younger patients.
Could there be other aminopeptidase inhibitors that could do similar things, do you think?
This is possible, but up to now, in my knowledge, it is the most energetic aminopeptidase inhibitor we know, so or almost tested in the clinics.
So what's the bottom line message coming out of this clinically then?
That is that Tosedostat is very promising and probably will be associated not only with this low-dose RC, but possibly with other drugs such as the cytarabine or the azacitidine in acute myeloid leukemias, and that we hope to find a small gene set for a companion tool in therapy.